Hi everyone, I'm Dr. Faisel Sayed.
And I'm Dr. Dan McCarter.
And you're listening to Faisel and Friends, where we believe access to primary care is a right, not a privilege.
Faisel and Friends is brought to you by Primary Care for America, a diverse collaboration of innovators leading the way towards comprehensive, continuous, and coordinated primary care.
Today, Dr. Dan and I are talking about resolution, hope for holistic health in 2025. Let's get started. Hey, Dr. Dan.
Hey, Faisel, how are you?
I'm doing very well. All things considered. It's the end of the year. As 2024 is coming to a close, you always have me reflecting, and I've been reflecting a lot. We've seen a lot of challenges across the country, but in healthcare too, with burnout, the push for more efficiency, and, right now what we're all doing right now, chasing a lot of pressure right now with hitting metrics, all the end of the year metrics. But on the flip side, there's also, we're seeing all the passion coming back again with primary care doctors, especially those of us who are fighting to restore like the heart of medicine, which is a doctor-patient relationship, like we see with the DPC practices and the value-based care practices as well. But what has kept you hopeful?
I think it's real easy to get into a negative viewpoint of where things are. I know when we're recording this podcast in December, but when it's released will be after the first of the year. We'll be looking at who the new administration is bringing into healthcare. And there are some viewpoints that some of these people have that give us all pause, but I think part of it is going back to what we've talked about is only about 20% of healthcare comes from the physicians. So have no idea if any of these people will get confirmed, but RFK Jr. certainly has a focus on healthy lifestyle and dealing with chronic disease and improving the food supply. Dr. Oz is interested in having more universal health care, a Medicare for all model. And then Marty Macri, who we've talked about a few times, is very interested in more transparent cost information in healthcare and also more global equity he's looked at in the past. So I think there could be some good things coming out of this, but there's going to be a lot of talking heads only telling half the story. And it's going to be very important for patients to have access to a trusted source. And there's probably no more trusted source than their family physician. So I think it's going to be critical for them to have access to the primary care provider who they trust and have an ongoing relationship with. And so I think this can be a good thing. It can highlight the importance. Yeah, there's some people who are not interested in supporting vaccines. It's going to be much more important for us as providers to be able to have these conversations with patients to help them to decide what to do about that. What do you think? What's keeping you positive?
I remember, if you go through all the phases of being a medical student to a resident, and then you're a new doctor, trying to prove to yourself, prove to others that you know your stuff. And then we get to a place where we feel comfortable in our skin. And it's like every year that goes by, less is more. And less of the doctoring with the complex pathophysiology and the pharmacology, right? I feel like, and we've learned this and we know this, we know that the first step oftentimes with dealing with a lot of the maintenance routine things, that the core issues that end up driving to all the conditions that catch all the headlines, it's lifestyle.
Yeah, but we're just letting the cost of medicines we're in the economy where we're spending almost $1 in $5 and the economy is going into healthcare, and the cost of medicines just keep going up. So there's downward pressure on time with the providers to pay for those medicines. I had a patient, which, she was, I think, 84 years old. She had bought over-the-counter hearing aids from Amazon, which was, she was able to get the hearing aids for $200, but she put them in her ear and one of the earpieces came off and she left it in there for like 3 days before she came into the doctor's office. I was able to use the office that I'm seeing patients in now also has gynecologists in the office. So they had a colposcope, so I had the ability to use that as an operating microscope to give me binocular vision so I could grab the earpiece and pull it out. But it had been sitting in there so long that she had some infection behind it, and she had a perforated eardrum. And so I had to, I mean, that was old, but I had to be very careful about what kind of drops to put in. But these are generic drops, and they were $75 for just the bottle of generic eardrops. And that's a lot of money for somebody living on $1,400 a month, right? And that probably the cash out of pocket was more for her to get the eardrops than it was for me to spend the half an hour or so getting that thing out of her ear. I don't know how we do this. I don't know how we pay the staff that we need to be able to provide the services we need and continue to pay for all of these medicines.
I remember when I first got out of residency and having to deal with insurance. I mean, I was in a community health center, so we were fortunate. We got to work with the 340B prescription program. And I remember one of the more seasoned doctors who was used to dealing with insurance telling me in a similar situation with the eardrops. And I said, gosh, it's so expensive for these eardrops. And he was like, oh, just prescribe the same thing, but the eye drop form might be cheaper. And he was right. The eye drop form was cheaper. And he said, yeah, you can put the eye drops in there. You don't want to go the other way around. I thought, gosh, I mean, that was funny, but it's not funny.
Right.
Like the time that you had to spend. And so that I am hopeful. I'm hopeful that, with the new administration, especially if their focus is more on looking at things holistically, and the bias that I'm hoping that is that more of a focus on the relationship, especially the populations of people who've been failed by the system, that focus on restoring that relationship. Hey, I'm excited about that.
That is huge. I mean, just the social equity is such a barrier to healthcare. And ultimately, I was talking to our producers before we got started today, and they were talking about how they are living in California and the air coming across the Pacific is bringing particulate matter from China to our shores. And it's like, well, when you see the pictures of the Earth out in space, it's this little blue marble. It's not there. There aren't any borders between one group of people and another group of people. And the same happens in our neighborhoods and the cities. We have to figure out how to take care of each other. We're all living together on this little blue marble. So how do we help each other? Because we all benefit when other people are healthier, and we all lose when other people are sicker.
We got to zoom out and not get distracted by the road ahead. That's going to be difficult. We need to envision the blue marble that we're living on, and not give up on the vision of what medicine ought to be, because it is too easy to get bogged down by all the negative aspects of it. But it's the connecting with the patients, being there for the patients in ways that really matter to them, especially early on. I mean, when you have populations of people who feel like they have been cheated or they haven't been, I mean, they do. I mean, cheated is a strong word, but it's true. I mean, there's a large group of the population who feel like they haven't been given a fair deal with their interactions with the system. And so I think part of the challenge for people like me is, and especially when I'm meeting someone new, and I try to be intentional by catering my interactions more to what's valuable to the other person. But I've got my own biases too. I mean, someone's interacting with me because let's say they need a refill with a medication. And in my mind, I'm concerned about, well, maybe that refill of the medication is not what's going to keep them out of the hospital. So I'm worried about what's going to keep them out of the hospital. And they may not see that as valuable, because they don't trust me. If they don't trust me and I'm saying, hey, if you keep doing this is going to, and they're like, well, I don't really care about that. I really care about this. And for me and doctors like me, it's like, okay, don't go for the 100%. Go for what's valuable to the other person. You can get 10, 20%, 30%, which is a whole lot more than where you'd go if you're stuck on what, right?
Well, I mean, don't you think it's important to be having the conversation, right? I don't know if I've told you this story already. So I saw a new patient, and he said, well, I don't take immunizations. And we had a nice visit, and I didn't argue with him at all. You taught me not to tell people that they're wrong, never tell anybody they're wrong. So, but we had the nice visit, and then he came back a month later and we got to talking again. And I just went down and I said, now we talked about this immunization and that immunization. And he said, well, I don't know about those. And I said, well, can I share some information? He let me do it. And by the time I got done, he was like, he had agreed to take the flu shot and the pneumonia vaccine, but he was also saying, "Well, can I get the tetanus shot and the shingles shot?" And I'm like, "Well, wait a second. I think we better go for two at a time. I know we can give more than that all at once, but I didn't want to go overboard there." So, I mean, it completely turned around, but it didn't turn around by arguing or by trying to convince. It's like you said, it would turn around by building a relationship.
It's the small moments with the patient. That's what you ended up having an intimate moment with this patient, and it ended up having some of the greatest rewards. So especially for the students and the residents who are bogged down right now. Yeah, it is a small moments. It's a small moments, and it's those connections, and it's a relationship that makes meaningful change. And don't go for the 100%, because, like Dr. Dan just told you, the 100% you may end up getting a 300%.
But anyway, so I know you're working on with case managers and working for a different needy population than what we've worked on. I mean, what have you learned this year from that?
One of the challenges with working with underserved populations in general, and especially when you're working in a value-based care environment, is the hopelessness, overcoming the hopelessness that many people feel when they're at the end of the healthcare delivery system, where a lot of the reason they're interacting with the healthcare delivery system inefficiently is because of lack of access to some of the basic social things that most of the country takes for granted. When you're looking at the 10 to 20% who are really struggling with meeting some of their basic day-to-day needs, and because of that, there's a whole cycle of issues that end up happening. I'll share with you a story with one patient who she has bilateral above the knee amputations. Both legs are amputated above the knees. She's been falling a lot and going to the emergency room. And so I asked her about her wheelchair, and she said, no, I get around on an office chair with wheels. And so my interaction with her was with a video visit. And you can imagine, Dr. Dan, my shock to hear, I was going into the situation expecting to hear about obstacles between, her bed and the bathroom, or going from one room to the next room. And this is in 2024. This is just within the last month that we have Americans that are struggling in ways that, you really cannot believe unless you got to see it to believe it. If somebody told me, I'd say, no, there's no way in America that someone would be getting around that way, but that is the case. And then to go through the process to get a wheelchair is not the challenge, but really I wanted her to have an electric wheelchair. So there's a process that you got to go through to get an electric wheelchair. You have to get the physical therapy evaluation. You got to go through all these steps to be able to get that for the patients. And now, that's not something that me as a medical doctor, really need to focus there's teams of people that help. And so in a value-based care world, it's that team that comes together. You have, like you said, you have the nurses, you've got the nurse managers, you've got social workers who can not only help to make sure you get whatever the patient needs so far as the equipment is concerned, but also to do an evaluation with the patient's living situation to make sure that it's safe for them.
And that they can use it. I mean, when I heard you saying that a patient was getting around on an office chair with wheels, I wondered, are there hallways too narrow for a wheelchair to get down it? And that's the reason they were using the office chair as a way to get around.
She said the office chair is light enough to be able to load up to an automobile, than lighter than the wheelchair, and it's easier to navigate. Yeah. So yeah, sometimes you gotta put the chart down or put the computer down, look the patients in the eye and listen. It really is the small things that make the biggest difference in the long run.
It absolutely is. So where do you see the benefits coming from primary care into the new year? The glimmers of light on the horizon.
I've got a couple that I'm really excited about. I'm excited about it. So I'm working right now in a model where the company partners with the insurance company to help improve health outcomes for populations of people that are difficult to engage with. So the plans have struggled to engage with these populations of people. So I'm working over there, and there's a lot of great work that's happening with engagement. So much so that now the plans are coming back saying, okay, well, you're really great at engaging with these populations, but now we want to see the quality data and how good are you at capturing how complex the patients are and stuff. So I'm excited about all of that work that's happening. I'm excited, we've had a couple guests now speaking about the power of artificial intelligence, how that's going to help bridge the gap of what we were all sold with medical records and the data technology from 20 some years ago, all the busy work that doctors and the care teams are having to do, that this is going to eliminate a lot of that busy work. So I'm excited with that. I'm excited about the evolution of direct primary care. I'm excited, especially with the work that's happening with, in particular, with the direct to employer space. We had one of the guests who were on this past year, or might have been the year before, talking with us about, doesn't matter what your business is. You could be in the business of selling sneakers. One of your main budgets that you have to sort out is healthcare. But I can't remember who it was that said that to us, but that's true. We don't think about the cost of medical benefits is now approaching almost $30,000 per year for a family of four. When 25 years ago, which wasn't that long ago, it was just maybe $2,000, $3,000 for a family of four to have, and without the deductibles, with mostly copays and things like that. So that work is going to help drive down the cost of care. And ultimately, what everyone is doing in these spaces is, they're focused more on less of the cookie cutter sort of algorithmic approach to end stage conditions with these very scary complications of unmanaged blood pressure, or you're letting go of impaired fasting glucose and diabetes, and we see all the scary things that happen in the emergency room, to really nipping things in the bud early on. I'm very excited.
Yeah, well, and I think that's absolutely true. We set behaviors at a young age that you're then following through. And right now, a lot of the discussion on chronic care management is how to deal with the outcomes of that. And the other question is how do we get people to live a healthier lifestyle? I was being back at the University of Virginia now, where Thomas Jefferson certainly never passed away. I ran across a quote from him from 1786. Of all exercises, walking is best. No one knows till he tries how easily a habit of walking is acquired. I've known some great walkers and had particular accounts of many more, and I've never knew or heard of one who was not healthy and long-lived. The species of exercise, therefore, is much to be advised. Now, this is pretty good advice for all of our patients today, right? I mean, this is over 200 years old advice, and it's still pretty good advice to do that. But it really is. It's the simple things. It's the relationship. It's eating non-processed foods and staying active is very important going forward, don't you think?
That's so powerful, Dr. Dan. Those of you who are listening, this is definitely a shorter episode, but we're excited for 2025. Let's do our part to try to make this a year where we restore the heart of medicine and make healthcare more about the relationships in the centers between the doctors and the nurses, the doctors with each other, right? With being able to curbside each other. It doesn't matter. You might be a primary care doctor that's a shoulder doctor, but more of the shoulder injection kind of doctor. Maybe you're the primary care doctor that's a trigger point injection kind of doctor. Let's focus on restoring the relationships for us within the system, and then as well as, of course, with the patients. Keep pushing forward, keep caring for each other, and never lose sight of why we all got into healthcare in the first place.
Good words of advice. What are your thoughts on resolution hope for holistic health in 2025. You've heard ours. Now we want to hear yours.
Email us at faiselandfriends@gmail.com, and your question could be featured on the podcast.
If you like this episode, leave us a review and tell us how we're doing. And don't forget to subscribe wherever you listen to podcasts so you never miss an episode.
Connect with us on social media by following Faisel and Friends.
And follow Primary Care for America on LinkedIn and Twitter.
I'm Dr. Faisel.
And I'm Dr. Dan.
And thanks for listening. This podcast is brought to you by Primary Care for America Collaborative and produced by Split Prism Productions.